Today in this ultrasound video, you can see the partially filled bladder and left hemorrhagic ovarian cyst is seen in this pelvic ultrasound video. So this is a normal sized and inverted uterus with central endometrium, minimal fluid seen in curly sac. So this video shows pelvic inflammatory disease and left ovarian hemorrhagic cyst. So this is a normal sized and inverted uterus with central endometrium. Minimal fluid seen in curly sac. You can see the minimal fluid seen in curly sac, which is the sign of pelvic inflammatory disease. This is a left ovarian hemorrhagic cyst. Why this is hemorrhagic cyst? It shows internal echogenic material within the cyst. So this mostly indicated the left ovarian hemorrhagic cyst. So when we want to rule out any pathology regarding pelvis, so trans-abdominal ultrasound for pelvis is performed with full bladder. So if you want a good ultrasound and you want to rule out any pathology, always go with a full bladder for trans-abdominal ultrasound. When doctor advise you the transvaginal TVS, transvaginal ultrasound, always go with the empty bladder. So in this video, you can see the normal sized and inverted uterus with central endometrium, minimal fluid seen in curly sac. This is fluid can be seen in curly sac. So this is a pelvic inflammatory disease. So this patient presented with the severe lower abdominal pain and dysmenorrhea. So during the scan, we find out the pelvic inflammatory disease and left hemorrhagic ovarian cyst, measuring about 40 mm into 35 mm. So that's all for today. This is adrenal cyst and fluid seen in curly sac. So mostly lower abdominal pain or pain or AF is mostly mixed with the acute appendicitis. So ultrasound abdomen is very important to rule out any pathology. So this patient literally was planned for appendectomy because of severe lower abdominal pain. So what we find out in ultrasound pelvis, hemorrhagic cyst and pelvic inflammatory disease. So ultrasound abdomen or ultrasound